Along with the option of face-to-face interpreting, phone interpreting can be a valuable option for patient appointments or procedures. In some regions and for some languages, it is the only option available.
Mr. Gill, you are here today for an appointment. You don't speak English?
If you do not know what language the patient speaks, you can use a point-to-language card to help the patient identify their preferred language.
Punjabi, you speak Punjabi?
Yeah.
Okay, let me call an interpreter.
For effective phone interpreting, it is helpful to have a speakerphone or a phone with two handsets. It can also be helpful to have an enclosed or semi-enclosed space to help block out background noise.
Provincial Language Service, Patrick speaking. How may I help you?
Yes, I need an interpreter for Mr. Gill.
All right, please stay on.
As mentioned in the first clip, a professional interpreter can usually be reached on the phone within minutes.
Hello?
Hi, my name is Tracy and I'm with the Speech and Language Service and I have Mr. Gill here. Could you please tell him that he's here for a speech and language assessment?
ਹਾਂਜੀ ਇਹਨਾਂ ਦਾ ਨਾਂ ਟ੍ਰੇਸੀ ਹੈ ਤੇ ਇਹ ਬੋਲਣ ਤੇ ਭਾਸ਼ਾ ਦੇ ਸੇਵਾ ਵਿੱਚੋਂ ਤੇ ਇਹਨਾਂ ਨੇ ਤੁਹਾਡੀ ਬੋਲਣ ਤੇ ਭਾਸ਼ਾ ਦੀ ਜਾਂਚ ਕਰਨੀ ਹੈ
ਠੀਕ ਆ
A professional interpreter on the phone is an especially helpful option when you don't know in advance that there is a language difference between you and your patient. The situation at hand is simple and routine and does not involve any complex assessment, health concepts, emotional content, or sensitivity. The situation is time-sensitive and requires interpreting as soon as possible. You are familiar with the patient and have an established good relationship with him or her. There are only 2 or 3 people involved in the interaction and not a group. The encounter is expected to be relatively short, for example, under half an hour. The patient prefers not to have any other person physically present in the room. You need to get by until an in-person interpreter is available for a more complex discussion, or you are serving a patient who speaks an uncommon language for which no in-person interpreter is available.
I'm going to hold up a pen now. Mr. Gill, could you tell me what this is?
ਹਾਂਜੀ ਇਹਨਾਂ ਦੇ ਹੱਥ ਵਿੱਚ ਕੀ ਹੈਗਾ ਹੈ
ਪੈਨ
ਪੈਨ
Great.
Using phone interpreters instead of in-person interpreters in these types of settings can also help promote the cost-effectiveness and sustainability of interpreting services for the entire health system. Through these clips, you have seen some of the different methods and benefits of working with professional interpreters. If you have any questions or comments about interpreting services within a Lower Mainland Health Authority, please contact Provincial Language Services at lmis@phsa.ca.
Well, I think that's great. Thank you for coming, Mr. Gill.
ਹਾਂਜੀ ਬੜੀ ਮਿਹਰਬਾਨੀ ਤੁਹਾਡੀ ਆਉਣ ਦੀ
ਠੀਕ ਆ
that's fine